Good morning. My name is Mary Lockenbrook, and I'm the Director of Benefits for the Montana University System. On behalf of the Commissioner of Higher Education and our entire benefits team here at the Office of the Commissioner of Higher Education, welcome to annual enrollment for fiscal year 22. This will be our plan year that runs from July 1 of 2021 through June 30 of 2022. Our agenda today will look much like it has in the past. We will talk a little bit about what it means for us to be a self-funded plan. We'll walk through our annual enrollment dates, eligibility information, and then all of our benefits, including medical, pharmacy, dental, vision hardware, then our fiscal year 2022 plan rates, some changes to the long-term care benefit, the availability of the dependent hardship waiver, our 2021 wellness programs, because remember those run on a calendar year rather than the fiscal year, our employee assistance program, flexible spending accounts, and then I have Ginger MacDonald here from Blue Cross Blue Shield to walk through some exciting new program offerings sponsored by Blue Cross Blue Shield of Montana. And then finally, the enrollment reminders that you will need as you begin your online annual enrollment process next week. First of all, what does it mean to us that we are a self-funded plan? And I know that we've talked about this in past years, but I just wanted to remind you, first of all, that our plan, the Montana University System Self-Funded Health Plan, is part of a Section 125 cafeteria plan. That Section 125 refers to IRS code. That's the section where you can find the requirements. And at its base, what this does is allows employer-sponsored plans that provide certain qualified benefits to provide those expenses on a pre-tax basis. That includes your medical premiums and some other things such as the flexible spending accounts. So at its core, a self-funded plan like ours, operated through Section 125, is at its core a tax vehicle. The way that it works is all of our self-funded benefits, including medical, prescription drug, dental, vision hardware, and flexible spending accounts, are self-insured or self-funded. So our premiums go directly into a fund, an asset account, which is used to pay the cost of benefits for all of our plan participants as they experience an illness or injury or any other benefit of the plan, such as preventive benefits. In order to keep our plan financially sound and affordable, it is extremely important that all plan participants use benefits responsibly. That responsibility could include things like asking questions before you receive elective procedures. Perhaps it's checking on multiple providers who offer the same benefits. It may be reaching out to the third-party administrator to talk about network providers and what the differences are on those fronts. We do expect our plan participants to pay a portion of medical costs in the form of annual deductibles, percentage coinsurance, or flat dollar copayments. These cost containment features are part of our plan design so that plan funds are available should a high-cost medical emergency or a catastrophic illness become the life for a plan participant. It's really important to us that we maintain a fiduciary responsibility within our plan that ensures that we have the funds available when somebody actually needs those. Our annual enrollment for fiscal year 22 will open on Monday, April 26th, and it will close on Friday, May 14th. It's really important that if you want to make any changes for the upcoming fiscal year, that you get online and make those changes during this time frame. Part of our responsibility as a plan is to ensure that all plan members are treated in a consistent manner and that we abide by all of the specifications as they are outlined in our summary plan document. So one of the specifics that is regulated by the IRS is eligibility and enrollment. So once the plan makes decisions such as enrollment dates, we have to strictly adhere to those. So any changes that you want to make for the upcoming plan year, please make sure that you do them during this time frame of April 26th through May 14th. So eligibility information for fiscal year 22. I don't anticipate that you will see much has changed from last year, but it's always good for us to have reminders and walk through what you can and cannot do in terms of eligibility. Any eligible dependent children up to age 26 may be enrolled in medical, dental, and/or vision hardware benefits during the upcoming annual enrollment period. Those will be for a July 1, 2021 effective date. Our plan continues to have a closed enrollment for medical and dental coverage for a spouse. So what that means is that you may not go into the Benefit Solver platform during annual enrollment to add a spouse unless you have a qualifying event. Proof of eligibility or dependent verification is required for all new dependent children being added to the plan for that July 1, 2021 effective date. A mid-year enrollment or disenrollment may only occur with a qualifying event or during a special enrollment period. So this includes things such as marriage, birth, loss or gain of eligibility for other health coverage. And please keep in mind that mid-year or qualifying event changes must be consistent with your change in status. So that means that if your change in status, for example, is the birth of a baby, a birth is adding a dependent, which would then allow you to increase other benefits that you have on your plan. If you're dropping somebody from your plan because that individual gained eligibility for other health coverage, dropping someone or losing a dependent allows for decrease in certain benefits. So just keep in mind that mid-year enrollment or qualifying events do require that your changes be consistent with whatever that qualifying event may be. Our medical plan benefits, again, we are just outlining for you some of the basic benefits, some of the things that people are looking for when they look at what the plan offers. There are no changes to your basic medical benefits for the upcoming fiscal year. Primary care physician office visits will remain at a $25 copay for in-network providers. In-network specialists remain at a $40 copay. Coinsurance for all of the things to which coinsurance applies remains at 25% in-network. Emergency room facility visits for the room charge only is a $250 copay. Urgent care visits, a $75 copay. The in-network deductible will remain at $750 per individual or $1,500 per family. And the in-network out-of-pocket maximum on the medical plan will remain at $4,000 per individual and $8,000 per family. And again, the eye exam benefit is one per plan year with an in-network provider at a $0 copay. So no changes to any of those benefits, which I think is really good news for all of our plan members. I think that when you look across the marketplace, whether it's public or private, in-state or out-of-state, to have a $750 individual deductible is still a really, really good benefit. So we're thrilled that we're able to hold all of those benefits at the status quo for another fiscal year. There are some new benefits that will apply. Some of them have been added as a part of legislative changes that occurred during the pandemic, and then our inter-unit benefits committee has decided to add them indefinitely. The first that I'll speak to is telemedicine. Interesting, some of you may have been really aware, and some of you may be not so aware of some of the changes that happened at the national level really quite rapidly. I would say in my 32-year career, I have never seen federal legislation that would change tax law and healthcare benefits happen as rapidly as it happened during this last year. So the first thing that happened was on March 18th of 2020, the Families First Coronavirus Response Act was signed into law. That was really when the telemedicine visits began to be covered by virtually all health plans, the university system included. There were some pretty strict requirements around telemedicine visits in that legislation, but it was quickly followed by the CARES Act. On March 27th of 2020, that act was signed into law, and that relaxed some of the restrictions on telehealth. And that's when we saw coverage for some of the outpatient rehabilitation therapies through telemedicine. Initially, it was really focused on mental health counseling visits, and then expanded to include primary care visits, even some specialist visits, and then outpatient rehabilitation services. So the Montana University System Health Plan will now effectively provide coverage for telehealth visits throughout upcoming plan years, and they apply just like any other medical benefit. So if it's a primary care visit, it's a $25 copay. If it's a specialty visit, it's a $40 copay. And of course, any plan limits such as outpatient rehabilitation maximums would apply to telehealth as well as to an in-person face-to-face visit. The second big change to the plan is an expansion of the outpatient rehabilitative services. We, effective July 1 of 2021, are increasing that maximum from 30 visits to 60 visits. It's really important that you understand, however, that the 60 visits will be a hard maximum. And by that, I mean that we will not be reviewing every physical therapy case for potential expansion of visits. So we're asking our members to really take an active role in managing those visits. And Blue Cross Blue Shield has agreed to help us with provider communications as well, so that providers are aware that really, this will be a hard-coded 60 visit limit for outpatient rehabilitation. And the only things that would be considered for review, we do have some true case management cases. The ones that come immediately to mind have to do with some pediatric cases that involve a number of behavioral therapies, a couple of stroke patients that have had perhaps some extensive inpatient rehabilitation and now are on outpatient case management. But the regular visits will be hard-coded to set that maximum at 60 visits. Please keep in mind that outpatient rehabilitation includes all of our outpatient rehab services. So that would include physical therapy, occupational therapy, speech, cardiac, respiratory, pulmonary, massage, acupuncture, and chiropractic therapies. So it's a 60 visit maximum for all of those outpatient therapies combined. Please understand this is not inpatient rehabilitation. Those are true rehab services, and those are completely separate and do not have these maximums imposed. Of course, we always encourage you to ensure that your providers are network providers. Blue Cross Blue Shield of Montana has made that easy for our members by having a really inclusive nationwide network. But we always encourage you to check prior to receiving any services to ensure that your provider is in network. We've provided the website for you to make it easier. You also can always reach out to Blue Cross Blue Shield via telephone call or email to check on your provider status. The prescription drug plan will also remain unchanged this year. Navitas Health Solutions will continue as our pharmacy benefit manager, and Lumicera Health Services will continue as our specialty pharmacy. Please keep in mind that for our active employees, CVS, Target pharmacies, and Western drug pharmacies are not in network. You may use those pharmacies, but utilization will require you to take responsibility for all charges at those pharmacies. You can continue to fill prescriptions at a participating retail pharmacy for either a 34-day, which we consider a 1-month supply, or a 90-day supply. We have noticed over the past 2 years a substantial increase of the filling of retail 90-day supplies, which is, I think, good utilization because it does help our plan members maintain compliance with their medication regime. You may also continue the mail order prescriptions for a 90-day supply through Ridgeway, Costco, or MyRx. Just keep in mind that MyRx only delivers to Montana, Idaho, Washington, Wyoming, and North and South Dakota. So the copays do not change on our prescription drug plan. The tier $0 has a $0 copay. Tier 1 has a $15 copay for a 1 month supply or a 30-day copay for a 90-day supply. Tier 2 continues at $50 for 1 month or $100 for a 90-day supply. Tier 3 is a 50% coinsurance, and that tier does not apply to the out-of-pocket maximum. Tier 4 is specialty drugs, and they have a $200 copay or 50% for a coinsurance at retail pharmacies. The out-of-pocket maximum remains at $2,150 for an individual or $4,300 for a family. And again, tiers 3 and 4 do not apply to that out-of-pocket maximum. And that's the 50% coinsurance. The $200 copay does apply to the out-of-pocket maximum. Just a reminder that for the current fiscal year, we did start our Copay Max program that is administered by Navitus. And what that does is create a benefit design that leverages copay assistance cards to reduce both the member and plan cards. And in a nutshell, what it does is it allows members who purchase certain specialty medications through Lumacera Pharmacy to utilize copay assistance to get their copay down to $0, and it does reduce the amount that the plan pays, at least during the time that the pharmaceutical copay assistance is in effect. So it's a win-win for both the plan member and for the plan. This is only available to commercial plan employees, which includes active employees and non-Medicare retirees. For fiscal year 22, the university system has agreed to participate in the Semper Health Discount Program. This is a brand new program that Navitus is administering. And in a nutshell, this program is a text messaging program that is designed to improve adherence and affordability for certain chronic disease medications by lowering copays when members fill prescriptions consistently and on time. If you do qualify for this program, and please understand that it's brand new, so at this time, the drugs that are available through this program include anticoagulants, Eliquis, Pradaxa, and Xarelto, and just recently added 2 anti-diabetics, which are Jardiance and Farxiga. So if you take those medications, then you would be eligible to participate in this program, and you would actually receive information about your eligibility. It's completely administered via text message, and what happens is your copay can be decreased over time based on your compliance, which is measured by consistent on-time refills of your medication. So what would happen is over time, let's say that you're taking a medication that has a $50 copay for a 1 month supply, and you fill over 3 months consistently, then the pharmacy manufacturer starts to chip in toward your copay. So you might see that decrease from $50 to $40. And then maybe after another 3 months, and this is just hypothetical examples, over the next 3 months, you may see it drop down to $30. And what's happening is that the pharmaceutical company is pitching in toward your copay. And then on the flip side, let's say that you don't fill on time for 3 months and you've been paying $40, but you didn't fill your prescription, and now you go in to fill it in month 4. you may see that copay back up to the $50 level. It will never increase beyond the plan's copay amount. So there is no penalty to you in any way, but there is the potential for you to reap a benefit from this program. So brand new, we will have updates as time goes on, but we are excited to offer this opportunity to our plan members. On our Choices Dental Plan benefits, you will not see any changes to the plan design. We will continue to have Delta Dental as our third-party administrator, and we will have both the basic and the select dental benefit options for the upcoming fiscal year. We are, however, increasing the fee schedule reimbursement maximums, and Delta Dental has been an exceptional partner in helping us both with the underwriting that was required and getting the data in place so that we could make the decisions about how to increase the fee schedule reimbursements. So I think that that's an exciting change for all of our plan members for the upcoming plan year. Remember that the basic plan only offers diagnostic and preventive services, and it has a $750 annual maximum. The select plan offers comprehensive dental benefits along with orthodontia benefits. There is a $2,000 annual maximum per covered member for the select plan for your diagnostic and preventive, basic, major, restorative, and actually the maximum only applies to basic and major restorative. The diagnostic and preventive do not apply to that maximum. So that is really an enhanced benefit that we added several years ago now that ensures that our plan members who do need major restorative services and may use that $2,000 annual maximum because they need a root canal, a crown, and a bridge, they still have the availability of those diagnostic and preventive services, which would include your cleanings and some basic x-rays. There is, in addition on the select plan, an orthodontia benefit that allows for a $1,500 lifetime maximum for orthodontia services. The vision hardware benefit will again be administered by Blue Cross Blue Shield of Montana. This is the vision hardware benefit only. Remember that your eye exam is covered under the medical plan, one per benefit year with a $0 copay if you utilize an in-network provider. The vision hardware benefit has a $300 annual allowance per covered member, and it is for eyeglass frames and lenses in lieu of contacts. However, we have an exciting enhancement this year. We are increasing the allowance for contacts from $150 per year to $200 per year. Keep in mind, this is still one purchase per year. So if you're planning to utilize the $200 contact allowance, it may mean perhaps that you're buying a full year's supply at one time to make that one-time purchase. Really exciting news on the premium front. I think that you'll all join me in really being excited that there are no changes to the 2022 fiscal year premium rates. They will be exactly as they are today for fiscal year 21. Your employer contribution will remain at $1,054 per month. I just wanted to point out that this is the fourth year in a row that the Montana University system has not had an increase on medical premiums for our active employees. That really is unheard of in the industry, and there are a number of factors that go into our ability to offer the flat premiums. And again, it's a myriad of things. We have an extremely engaged inter-unit benefits committee that are really active in helping us talk through scenarios, situations, options. We do both clinical and financial risk management. We review all claims over $50,000. We're really active in terms of collaboration with our third-party administrator and looking for ways to enhance value and quality, because our philosophy at the Montana University System is that we want to do the right thing at the right time for the right reasons, which really means the right thing for you and your families, of course, within the confines of state and federal regulations. But I think some of the contracts we've signed over the last year or two, along with some of the risk management and the engagement of our committee, really allows us to come to you in year 4 and say, again, there is no increase at any level for your medical benefits for fiscal year 22. Long-term care. This is a product that you've seen a number of changes over the last few years. Those of you with longevity with our system may recall a few years ago that Unum stopped selling long-term care group policies. And then last year, we were notified that there would be a significant premium rate increase for our participants as of July 1. And so in order to counter some of those premium increases, we agreed with Unum to close the long-term care plan to new participants. That would allow our current enrollees to remain on the plan at their current premium rate. We received notice again this year indicating that Unum is increasing premium rates substantially, up to 83.4% for our current long-term care plan participants. So as a result, we have made the decision to no longer offer the Unum long-term care group benefit. What that means to our current plan participants, and please understand, it is extremely important to us to ensure that there is an appropriate transition to all of you who are currently covered under the long-term care plan. You will have the option to convert your current group-sponsored long-term care plan to an individual long-term care plan with Unum. There is a conversion application that you will need to fill out, and we are working with campus HR offices to make sure that each person currently covered under the group long-term care plan receives that conversion application form and has that opportunity to convert the coverage to an individual plan. What that will mean to you if you choose to convert is that you will begin paying your premiums directly to Unum, and you will not pay them anymore through payroll deduction on your campus. We wanted to remind you all that the Montana University System does offer a benefit that is pretty unique in the world of employer-sponsored group health care. We offer a dependent premium hardship waiver. What that waiver does is it assists families who have a financial hardship with the cost of medical health care for their dependent children between the ages of 0 and 26 who are covered on the university system medical plan. We do require that the family first apply for Healthy Montana Kids coverage for all children under age 19. We, of course, don't require that application for children age 19 and over because they will age off of Healthy Montana Kids when they reach age 19. So if the family is denied coverage through HMK, they then can request a financial hardship through our plan. There is an application for the financial hardship, and it is reviewed in our office. And if the total household income is not more than 120% of the Healthy Montana Kids guidelines, then we will provide the waiver for those dependent children for the plan year. So July 1 of 2021 through June 30 of 2022. Families must reapply every year for both HMK and the dependent premium hardship waiver. And if you have questions about the dependent premium hardship waiver, please call our main benefits line, and we've provided the number for you here. There is also the opportunity to visit our Choices website and check out information on the dependent hardship waiver. It's just another commitment that the plan has to ensuring that families have an opportunity to make sure that there is coverage for dependent children. We are continuing through calendar year 2021 to offer a wellness incentive program. This year's incentive program launched on January 26th, and again, It is available to you through the Limeade platform. There was a transition in 2021 to the Limeade One platform, so you may notice some differences when you log on. There are some enhanced communication opportunities on the platform, and you will still see the regular incentive challenges and your wellness assessment and the opportunity to earn points for all of the things that you've seen similarly in the past. The wellness incentives are offered again at 4 levels this year. The first level is the Scout level. When you reach 1,000 points and you've done the mandatory required things, which include the integrity pledge, the assessment, and your well check, then you are eligible to receive a Fitbit health tracker. That allowance is automatic, and if you want to upgrade, you do have the opportunity to pay the difference between what the plan is financing and what your upgraded tracker might be. I do want to let you know that some of you may have already reached the Scout level, and there was an issue with the automatic link to be able to claim your Fitbit tracker. Limeade is working on that, and they have indicated that they will be sending out a second email to all those who have already leveled up to Scout, and you will get an emailed link to that Fitbit health tracker. Those of you who have not yet leveled up, we have been advised that everything should work smoothly for you. Level 2 is the Explorer level and allows you to receive a $35 Amazon gift card. Trailblazer is level 3 and again is a $35 Amazon gift card. And the final level, Expedition Leader level, 4,060 points. See how we keep that 406 theme in there. And that is a really cool camp hammock that our wellness team has located. So you would be eligible to receive one of those at level 4. Keep in mind that claiming gift cards will result in payroll taxation. If you are interested, the Limeade One app is available. You can download that on your mobile device, and then you'll be able to access all that Limeade has for you on the go. Some of the highlights of our wellness program for 2021. Like most everything else, when the pandemic hit, we really had to spring into action and make changes right away. Many of you were impacted as we had to pretty much overnight it. I would say it was over a weekend that we were canceling well checks for last spring for the March and April timeframe. And then as we were starting to work toward what we could offer in the summer and fall, we were looking at a number of things that included some enhancements to your 2 free well checks per year. It Starts With Me continues to be our provider for our well check services, but those of you who have taken part in our well checks may have noticed that we added some enhanced opportunities for you to get some lab screenings at no cost. So the plan has been picking up the cost for the COVID antibody test, for the vitamin D test. Those 2 we've taken over to the fall, actually from fall to this spring of 2021. We also in the fall offered some COVID screening, and that was for asymptomatic individuals. And we also offered a blood typing test. I'm not sure how far we'll be able to extend the offering from these tests, but we've received a great deal of positive feedback, particularly about the COVID antibody test and about the vitamin D test. Many people in Montana have found that they are vitamin D deficient, even people who spend time in the sunshine. Montana doesn't receive the kind of sunshine that some other states like Florida and California do. And many people are deficient in vitamin D. So the reason that we added this test is that there were some initial studies that were linking both those people who were getting sick with with COVID-19, as well as those hospitalized with serious illness and death, there were some links to vitamin D deficiency. In addition, vitamin D plays a role in the presentation and treatment of a number of conditions, including diabetes, hypertension, multiple sclerosis, and depression. So we, with the number of people that we're finding do have a vitamin D deficiency, we're thinking that at least for the fall and spring offerings, that was probably not only well received, but probably very valuable for our plan participants. In addition, we continue to offer live fitness and nutrition webinars with recordings available online, live fitness and nutrition workshops, the Montana Moves and Montana Meals blogs, our Well Baby program, which requires enrollment within the first trimester to have eligibility for all benefits. There are other benefits for those late enrollees. We continue to research what we may be able to do in the future with regard to maternity programs, and we're anxious to work with Blue Cross as well as our third-party administrator with what we might be able to do in this arena. In the last 3 months, the Montana University system has seen an unprecedented number of preterm deliveries. So, we really are wanting to make sure that we're doing everything possible to ensure healthy pregnancies that result in healthy moms and healthy babies. We continue to offer our Take Control Lifestyle Management Program, which is a 12-month program. We offer an opportunity for all campus members to get involved via Campus Wellness Champions. So we would encourage you to research, reach out, and get involved. We continue to have a quick help program, which is a Q&A support regarding health, fitness, and nutrition. And again, for fiscal year 21, actually calendar year 21, our incentive program includes WILL, which you may recall is the digital training for mindfulness, sleep, yoga, and much more. Our Well Baby program, again, is a voluntary program. Benefits include copay waivers for prenatal and postpartum office visits, ultrasounds, routine maternity lab work, and physician delivery charges. Again, this requires enrollment in the first trimester, and benefits begin the day the participant enrolls. It is not backdated. Also provides benefits for prescription generic prenatal vitamins at no copay, some pregnancy books, and there are some choices in that regard, as well as the opportunity to enroll in the Take Control Lifestyle Management Program. And there are some benefits in that program designed particularly around maternity and postpartum. Take Control, again, is a voluntary program that offers comprehensive and confidential education and support via a telephonic delivery method. This program is designed for those who meet requirements for high blood pressure, high cholesterol, weight loss, diabetes or prediabetes, tobacco cessation, and maternity via the Well Baby program. This program has one-on-one monthly phone sessions with licensed dietitians, exercise and sports science trainers, and certified diabetes educators. We also have a Montana University System Employee Assistance Program that is coming up on its 1-year mark with our plan. Reliant Behavioral Health is our partner in providing the Employee Assistance Program. It essentially is a free confidential employee benefit program that assists employees with their personal problems or work-related problems or issues that may impact job performance, health, mental or emotional well-being. The services are available to employees, dependents, and all household members. So this is a unique benefit in that they do not have to be covered on your health plan, just living in your household or your dependent. The services include 24-hour crisis help available via toll-free access. In-person counseling, you're eligible for up to 6 face-to-face counseling sessions per issue for relationship and family issues, stress, anxiety, and other common mental health challenges. There is also e-access available, which is access to online consultations with licensed counselors. In addition, there are provisions for webinars, newsletters, wellness resources, self-directed courses, articles, stress tools, financial calculators, legal resources, retirement planning resources, child and elder care locators, and lunch and learn webinars. Amy Berry is our staff member here at the Commissioner's Office who leads this program for benefits. And if you have questions or ideas, suggestions, anything, I encourage you to reach out to Amy. We are working in collaboration to try to really ensure that we have a valuable suite of benefits in this arena for our employees and their family members. We understand that the pandemic has impacted employees in numerous areas of their life, and we want to be available to provide benefits that will help you in these situations. One that we have had increased questions around is the area of wills and trusts for children. So Amy and I are having conversations with the EAP provider about some opportunities that would allow us to provide enhanced benefits on your campuses with regard to preparation of wills and trusts. But those are just two areas where we've received increased questions. So if you have them, get to your campus HR or reach out directly to Amy Berry. Flexible spending accounts. This is an area that I anticipate we may have a number of questions. Flexible spending accounts, remember that you must enroll every plan year if you want to participate in a flexible spending account. This includes healthcare, limited purpose, and dependent care. No exceptions can be made on late enrollment. What that means is that July 1 is the start of the plan year. The only opportunity for changes after annual enrollment, which ends on May 14th, is if you detect an error. So please get online and enroll in your flexible spending accounts between April 26th and May 14th. On the first payroll that would happen in July, if you've noticed an error in your paycheck, you can take it to your human resources. They can review and come to the Commissioner's Office benefits team for review to determine if we have made an error. But if we have not made an error, there are no changes after July 1. So please check your elections carefully after annual enrollment. To be eligible for reimbursement, all fiscal year 22 flexible spending account claims must be received by WageWorks by September 30th of 2022. That does not mean that you put them in the mail on September 30th. They will not be received if you mail them on September 30th, or really even probably on September 28th. They have to be received by WageWorks by September 30th. Flexible spending accounts are a tax vehicle and they are governed by the Internal Revenue Service. We do not have much flexibility with regard to flexible spending accounts. The university system will continue to pay all of the flexible spending account administrative fees. So there are administrative fees for every one of these accounts that are paid to WageWorks. We are not charging those to the individuals who have accounts. We are paying them from the plan. Just a heads up that WageWorks is transitioning to health equity during the spring of 2021. Our team here at OCHI has worked really collaboratively with WageWorks to ensure that there's not a huge disruption or a great deal of misunderstanding with regard to this transition. So there will be co-branding of health equity and WageWorks throughout the transition process. The current website links are still applicable, and WageWorks links will redirect to health equity pages. So some of the items that you need to know about your flexible spending accounts. During the annual enrollment period, you may elect flexible spending accounts that take money pre-tax from your paycheck for your out-of-pocket expenses. For the healthcare flexible spending account, this includes medical, pharmacy, dental, vision, and over-the-counter prescriptions. So these are medical out-of-pocket expenses. If you or your spouse have a high deductible health plan with a health savings account, or you even have a health savings account. So if you're an employee new to the Montana University system and you had a health savings account with your prior employer and it has 53 cents in that health savings account, you may not elect a healthcare flexible spending account. Those are IRS rules, and it really is the health savings account that does not play well with flexible spending accounts. We would refer you to your tax advisors because these issues really would be between you and the Internal Revenue Service. But we give you this education because we hope to keep you from being caught in something that could be bad news for you or your family with regard to the IRS. What you could elect is a limited purpose flexible spending account. This would allow you and your spouse and family members to have access to reimbursement for out-of-pocket expenses for dental, dentures, contacts, eyeglass, anything that is not covered on a medical plan. There is a comprehensive list that is available at the WageWorks website if you are interested in a limited purpose flexible spending account. Our team here at the Commissioner's Office in Benefits has really worked to try to make the online system as user-friendly as possible. So they have asked for Benefit Solver to change the way the agree and disagree boxes appear on the platform. So what we found is that the majority of people, because I agree to elect the limited purpose flexible spending account was first, people were clicking that box. So even though what they really were intending to enroll in was a true healthcare flexible spending account. So we've moved for this annual enrollment the boxes so that I do not agree to the limited purpose shows up first, so that hopefully those people who agree are reading and really understanding what a limited purpose flexible spending account is. The only time you really would probably want to look at a limited purpose flexible spending account is if you or your spouse have a health savings account. The healthcare flexible spending account for fiscal year 22 remains at a minimum election of $120 and a maximum election of $2,750. If you do not enroll in a flexible spending account for fiscal year 22, and you have unused flexible spending account funds in the amount of $50 or less that are not expended, that means services rendered by June 30 of 2022, the flexible spending account will be closed and the remaining unused funds will be forfeited. The reason for this gets back to those administrative fees that the plan is paying for each individual account that is open with WageWorks. The administrative fees start to exceed the amount of the value of the account, and that is why we close those. New healthcare flexible spending account participants will automatically receive debit cards at no cost to the employee. However, if you are not a new flexible spending account participant, you had one, say, this year, and you're going to have one again next year, the amount on your debit card will be reloaded. You will not receive a new debit card. Your reimbursement options include direct deposit, the use of your WageWorks debit card, or you can file a pay me back claim and receive a check. There also is the opportunity to utilize the flexible spending account store, and you can access that and utilize your healthcare card as well. Okay, for the dependent care flexible spending account, again, the minimum for fiscal year 22 is $120. The maximum is $5,000 in terms of contributions. Dependent care flexible spending accounts, and this is very clear in the language on the Benefit Solver platform. as well as all of the documentation, including the workbooks, the information that we're providing in this presentation today, dependent care is not for medical expenses. Dependent care is for dependent care expenses, which includes live-in care, babysitters, licensed daycare or preschool centers, after-school care for children under the age of 14, schooling expenses at the kindergarten level and above, or overnight camps are not eligible. But please understand, dependent care is not a medical flexible spending account. We really need to make sure that folks understand that if you are electing a dependent care account, it primarily is designed for childcare with some elder care available for those who are guardians for elder dependents. Again, reimbursement options for this do not include a debit card. They are strictly via direct deposit or a pay me back or pay my provider. Now on to the flexible spending account information that may create a myriad of questions on your part. And please know that we understand the questions and we're hoping to clearly communicate this information to help you really understand what's in place today and what will happen in the future. Excuse me. So please make sure that when you make your elections, you are not electing more than you need to cover expenses that you expect to incur for yourself or your family members during the benefit year. The IRS use it or lose it rule requires that any money not used by the end of the benefit year be forfeited. The IRS permits healthcare flexible spending accounts to allow rollover from one benefit plan year to the next, but it is typically a limited amount, $550 to be exact. However, recall we were talking about the flurry of legislative activity. We saw those two acts in March, and then on December 27th of 2020, the Consolidated Appropriations Act was signed into law. That act allowed the Montana University System and other employer group sponsors to temporarily amend, and this was a voluntary act, temporarily amend healthcare flexible spending accounts, limited purpose flexible spending accounts, and dependent care flexible spending accounts to provide enhanced benefits for a limited time. What that means is that unused funds from all of those flexible spending accounts from July of 19 through June 30 of 2020, so fiscal year 20, we were allowed to voluntarily amend our plan to let participants enroll all of the funds that they had with Allegiance over to WageWorks. Then for fiscal year 21, our current plan year, which runs from July 1 of 2020 through June 30 of 21, we are allowing WageWorks to roll over everything to the new plan year for fiscal year 22. So that means if you we get to June 30th and you have money that you have not received services for to be able to spend, submit claims, you will be able to roll that over to fiscal year 22. We did not take much time to take part in that voluntary opportunity and get our plan amended because we felt like it was in the best interest of our employees to make this allowance. The one thing we are a bit concerned about, though, is that people must understand this is a temporary amendment and it will not happen in the future. So it will go from this current plan year into fiscal year 22, and then the regular use it or lose it IRS rules go back into play. So we don't want folks to make exceptionally large elections in fiscal year 22 with an assumption that there may be an opportunity to roll all their funds over again in the future, because we do not anticipate that that will be allowed. In addition, understand that this is unprecedented for there to be any allowance for rollover independent care accounts. So we're really thrilled to be able to offer this opportunity, and we really hope that we are clear in explaining how this works and the fact that it will end with fiscal year 22. If you do not enroll in a flexible spending account for fiscal year 22, and you do not have unused, or you have unused funds again that are $50 or less, just remember that that account will be closed and those funds will be forfeited. And then one other reminder about the temporary change for the extra time that you're getting, in essence, to utilize your flexible spending account funds, is it does not apply to terminated employees. It is only for active employees. So what that means is if someone, say somebody terminates today on April 22nd, then their claims would end with a service date of April 22nd. They will not have the rollover of those funds. Okay, the Healthcare Flexible Spending Account mobile app continues to be available. This is called the Easy Receipt mobile app. It's offered by WageWorks. It's really simple to use. It allows you to check your balances, submit claims, take snapshots of photos of your receipts, and manage your account on the go. If you have not downloaded this app and you have a mobile phone, I would encourage you to do so. It really is simple to use. And with that, I am going to turn this over to Ginger MacDonald. As I told you, she is our account manager with Blue Cross Blue Shield of Montana, our third-party administrator for our medical and our vision hardware plans. And we are really excited. We've worked through several opportunities that are presented by Blue Cross for enhanced benefits, and we are hopeful that these will be successful and we will be able to offer more in the future. But I would like to turn it over to Ginger now to walk you through some opportunities that are available to you beginning July 1 of 21.
Thanks, Mary. Hi, good morning. Again, my name is Ginger MacDonald. I'm your account executive at Blue Cross Blue Shield. So I was going to talk you through a couple of new programs that are available to MUS members starting 7/1. And then I'm going to give you some reminders of things that are out there currently for you to use. The first we're going to talk about is Wonder Health. This used to be known as Naturally Slim. Naturally Slim, or Wonder Health now, is a behavioral counseling program. It assists with weight management, diabetes prevention, and there's a couple of different platforms you can take with this program. You can simply do a 10-week program, you can turn that into a 20-week program, or you can use a full year and utilize the skills that you're learning and just maintain those through a full year. This is no cost to you as a member. The university system is picking up the cost in the background. These are weekly self-paced online video sessions. You can do them at your own leisure whenever you'd like. You can do them back to back if you'd like. It's available if you're over 18 and again on the MUS plan. So if you're interested in this plan, be on the lookout for more information. The website will be up and running by 7/1/21, but in the meantime, you should be seeing some information between now and then. The next new and exciting program is called Hinge Health. This is also an opt-in program. I neglected to mention that on the last program. These are both opt-in. You would have to be the one that wants to join these programs. Hinge Health is all about musculoskeletal situations. So this helps you with back, knee, hip, shoulder, or neck pain. It comes with a cool tablet and some wearable sensors whereby you're having one-on-one health coaching on your tablet with an exercise coach. There's a mobile app, and of course the wearable technology. It comes with, you know, your chargers, etc., and a little carrying case for travel. This is also at no cost to MUS medical plan participants that are, excuse me, over the age of 18. Okay, and now for some oldies but goodies. BAM is Blue Access for members. This is currently available out on our website for you and has been for years. So if you are a member and you're not utilizing this program yet, I strongly encourage you to go take a peek. There's a lot of information out here. What you see on the right hand of the screen is the set of links that are available out on BAM. You'll note that there's a well on target. You can get to your ID card. Of course, your benefits and claims are all out here online. There's Blue 365 discount program, and I'm going to talk through a few of these in a little more detail. This is just a snapshot of once you get out to BAM, this is what you're going to see. So this will show, if you could see on that top row across, it shows, pardon me, my coverage, your claim center, health, doctors and hospitals, and then forms and documents. I would point out right here that doctors and hospitals is where you're going to find a provider. This is what Mary was talking about earlier to make sure that you're staying within the network. So this is just one of the links that gets you out to find a provider. Off to the left now, you can see those quick links. If you look at that number 6, that's where you're going to see the fitness program and well on target. We're going to talk a little bit more about each of these. Let's go a little bit into well on target. So it's really simple to access well on target. Again, you're going to log into BAM. If you've never done that, you simply go out to our website, bcbsmt.com, and then you'll see it. It's going to be the square that you see right there on the page. And you are going to create a new user ID, and they'll give you a temporary password. You put in your new password, kind of like anything else that you're signing up for. And then once you're registered, you'll be good to go into well on target. And this just shows you how easy it is to get there once you're on Blue Access for members. Okay, so once you're out on the well on target portal, these are all of the things that you can access out there. So you can do a health assessment. It keeps a dashboard for you. It shows if you are synced up to a Fitbit or another tracking system, a nutritional tracking system. All of that syncs up to well on target. And everything that you're doing out here, or everything that is syncing up, is giving you these blue points in the background. And the blue points are actually rewards. So with the blue points, you are able to go out and redeem your points and kind of have an Amazon shopping experience, if you will. So you would go out, redeem your points, and you would search in what you're looking for. I recently bought my husband a golf ball tracker. I can't think of the name of those, but one of the watches that you wear when you're playing golf to track your ball. And it was super handy. I received it within maybe 3 days. It's a super easy and member-friendly process. This is just showing what your dashboard would look like. It would show all the points that you're accumulating and for what reason. And again, it connects and syncs the fitness and nutrition devices and apps. Also out on BAM, you'll see the fitness program. This is where you can get gym memberships at discounted prices. You'll see there's 4 different levels of those platforms. I searched around Montana, and in most cases, the larger towns and cities in Montana had around 7 gyms available through the fitness program. And to get out there, you again would go through the BAM portal and find fitness program. You'd sign up for that program, and you'll be given an ID card. With that ID card, you can go to a new gym that's in the network, or if you're currently going to a gym and you want to see if they're in the network, you can give them that card, and then you'll work with that manager or that billing person to get you set up on our fitness program. Okay, and here is yet another app. This is the Always On app. This syncs up with the Well On Target as well as the fitness program. Lots of information out here, and this actually adds a nutrition app that integrates into your Blue Points. So lots of different ways you can earn these Blue Points and keep tracking your own nutrition and your own health. Blue 365, this is not new either, but it's a great discount program if you've never taken a look out there. It is exactly that. It's a discount program. Because you have a Blue Cross Blue Shield card, you're eligible for these discounts. And you'll see on the left side of your screen the types of things that are out there. It's health driven, so you're not going to find like pizza or something like that. It's more of going out and looking for Reebok shoes or fitness centers at a discount. You can also get hearing aids at a great discount out here. So if that's something you're in the market for, I strongly suggest you go out and take a look at the Blue 365. This is found also on BAM under discount program. Okay, the Blue Distinction Centers. These are specialty care facilities that have met national measures for quality and cost-efficient care. So you can see there are 6 different specialty services that are listed there in the black bolded lettering. And those actually are on the website under our Find a Provider link. And you can click into each of those and it'll give you all of the facilities that are available for those types of services. So these hospitals obviously are the foremost experts in their fields, in these specialties, looking at the highest quality with a lower cost. There's national access. We do have a few Montana facilities that are within this, the Blue Distinction Centers. And again, you can find this by logging into BAM, find a provider. And if you don't want to do that, you can also just call the customer service number on the back of your ID card. They're happy to help you through this. This is a great question that they're ready to answer for you at any time.
Great, thank you so much, Ginger. Just one comment on the Blue Distinction Centers, and one of the reasons that we want to make sure that that is on your radar is because, as Ginger noted, we're talking about quality and cost, and ongoing conversations that we're having are around value of care. And so the quality comes into play, along with something for you to think about as a patient is, you know, getting to a facility or to a provider who does a service regularly. So I'm thinking perhaps of somebody who needs a knee surgery, and perhaps there's a provider that does 3 of those a year, or we have somebody that meets the criteria for a Blue Distinction Center and they have a provider who maybe does 1,200 a year. And again, that's a hypothetical example, but we're really starting to have conversations and thinking a little bit outside the box in terms of how do we really promote value, because cost is only one component. There are so many other factors that we have to consider: clinical risk factors, family circumstances. I mean, our list is probably pretty comprehensive and it goes on for a number of pages, I'm certain. But I want you to know that we are thinking about those things and we are looking at programs. And there is a program that I'll just mention that you may hear more about in the future, because we're still working out details for a July 1 effective date, and that is a lower joint extremity bundle. This is something that would allow for value to be built into the care and provide everything on a bundle basis, meaning wrap up your pre-surgical care with your post-surgical care and the surgery itself. And Blue Cross has been instrumental in helping work through this process with Bozeman Health. So it will be something that you'll hear more about as we approach July 1. But I just wanted that on your radar, along with all of the other services. Transplants are a big one where we would encourage our people to look at centers, Blue Distinction centers, because there are some pretty strict criteria around quality and those types of value-based measures. So Ginger told you that Blue Cross Blue Shield through the Blue 365 does have opportunities for discounts on hearing aids. And I just wanted to share with you that Delta Dental also has a program through Amplifon at no cost to our plan members that would allow you to get discounts on LASIK eye surgery or Amplifon hearing aids. So if you're interested in either of these programs, I would encourage you to take a look. I will tell you that one of the reasons we're adding this information is, first of all, it's a value-added benefit that Blue Cross and Delta Dental are offering to our plan members, no cost to the plan or to the participants. The other reason is hearing aids are actually an inquiry that we receive quite frequently about why does the plan not cover hearing aids. Some of you who have been following legislation may have even followed the pediatric hearing aid legislation that hit the Montana legislative session this year, and does indicate that there may be changes coming with regard to how plans provide coverage for these types of services. For this year, we were not able to add a hearing aid benefit for all plan members on the medical plan because we wanted to continue with the premiums being flat for another year. But it is something that the Inter-Unit Benefits Committee will continue to discuss. In the interim, however, know that you do have options available to you, both for hearing aids and LASIK eye surgery. Some of the products and services include the discounts on hearing aids or the LASIK eye surgery. Savings, there's a substantial saving for both of these services. There are a nationwide network of providers, and we've indicated the websites here if you're interested. One note, you cannot stack these discount benefits, so you would need to choose to use the hearing aid discount benefit through Blue Cross or Delta Dental. You could not stack them and take advantage of both of them. So now let's talk a bit about the BEBA system, the Benefits Enrollment Benefits Administration System. Again, this year we will offer centralized online benefits enrollment through Benefit Solver. That's our platform. This is for all campus employees. Employees can also use this for online mid-year changes if there is a qualifying event such as marriage or birth. Understand that qualifying events must be approved by your HR staff. Remember that the ability to upload new hire and qualifying event proof of eligibility is available to you on the platform. So if you need to add a birth certificate for your baby or a marriage certificate, you can do that online. This system stores your enrollment and benefit elections information, and there's an app for that also, the My Choice mobile app. If you have any questions about the enrollment, whether it's questions about what you can and can't do during enrollment, questions about benefits, questions about the platform, don't hesitate to contact your campus HR benefits office. They will be able to assist you, or you can also call our main benefits line. If you go to our website, you will see this Welcome to Choices page, and then down in the middle section, you will see the Benefit Solver login. So that is where you will go to begin your enrollment process on Monday. This is what the welcome screen will look like. So if you have been in before, you should have a username and password. If not, you will need to create your account. This is the home screen. It will continue to remind you how many days are left for annual enrollment. You will see the to-do and the ability to start here. And then a few reminders for you. Just a follow-up reminder that we do have closed enrollment for a spouse. If you do not submit any changes at all, you will automatically be re-enrolled in your prior plan elections, with the exception of your flexible spending accounts. You must enroll in a flexible spending account each plan year and specify the dollars you wish to have go into that account. Please, even if you don't want to make any changes and you don't want a flexible spending account, please get online and verify your beneficiaries for your life and accidental death and dismemberment coverages. And I would encourage you again to please have both primary and contingent beneficiaries. That's really important in the event that your primary beneficiary either precedes you in death or dies at the same time with you. Always make sure you have contingents. And remember that if you want your beneficiaries to be minors, that you should have a trust for minor children. The standard cannot cut a check to a minor child. So just encourage you to really get out there and make sure that your beneficiaries are appropriate for where you're at today. Sometimes our life circumstances change over time, and it's just a really good opportunity to get out there and check them every year. The Choices benefit books have been posted online on our website. They were out there this morning. And this presentation is being recorded and will also be put on our website by April 28th. So by middle of next week, for those who did not get to tune in today live, or for those who want to go in and just listen again to one area of benefits, that opportunity will be available by the middle of next week. A final provider network reminder: you want to check to make sure that your provider is in the Blue Cross Blue Shield network. Remember, they do have the Blue Cross Blue Card coverage throughout the nation. So if a provider participates with a local plan in the state where they are at, it would be an in-network provider for the Montana University system as well. The importance of the in-network providers is that they do not balance bill you. They write off the difference between the charge and the insurance allowable. Don't ever assume that your provider is in network. Please always check. Of course, if you have an emergency situation, that is not an option for you, but for any elective care, that is really important. Again, reach out to your HR office or to our benefits office if you need assistance. If you have questions around benefits, you can also reach out to Blue Cross for assistance in finding network providers. And again, one final plug for Blue Distinction Centers. These are exceptional quality centers for any specialty needs. With that, we will open up. We will have question time for about the next 5 minutes. So I will quit talking at this point and just thank you very much for tuning in today and for really taking the time to make the benefits choices that make the most sense for you and your family members. It's really important to us that the benefits that we offer add value to your lives and meet your needs. If you have questions, please go ahead and reach out now. We have staff here available to answer them. Thanks so much and have a great day.